As we continue to explore cutting-edge XR and immersive technologies, our next session focuses on multimodal learning and skill enhancement through advanced haptic systems. It is my privilege to invite Dr. Ravali Gourishetti, Haptic Intelligence Research Scientist at Max Planck Institute of Intelligent Systems, Stuttgart, to present multimodal record and replay system for enhancing tool-based skill learning. Dr. Gourishetti received her PhD from Haptics Lab.
Yeah, so I've started working on looking at fine motor skills for learning, for teaching any tool-based interactions. And a fundamental is the skill learning. And we have looked at the traditional approaches for teaching manual skills or fine motor skills, and we came up with experts discussions, and we see that two different methods have come up, and they are like physical guidance and also observational learning. Where physical guidance, there is an expert or a teacher guiding the student to move in the right direction, or to move or to have a movement in the appropriate direction. And observational guidance is more like they are trying to watch a demonstration, maybe in 3D, maybe in 2D, and try to learn from what the expert is trying to show and then learn for it. So these traditional methods have different challenges. We know, if we look into surgical aspect, we cannot feel the haptics, and we cannot look what the expert is trying to see, like the first person view. And so we came up with a system where we have the record and replay with the multimodal technology, where we recorded the audio, video, and haptic information while the experts are performing a task. So it's more like you have an embodied experience of an expert doing a task. So we had this system where we had the first person view by recorded with the help of a GoPro camera that's attached to the expert's forehead. And we have an external camera that's recording a third person view. We had the tool interactions by connecting a directional microphone, placing towards the tool and the interactions. And we had a lapel microphone that's attached to the experts while they are trying to give a narration of what they are performing. And we have an accelerometer attached for recording the vibrotactile feedback. So combining all these modalities and converting the acceleration signal into sound signal, and using a 5.1 surround sound module, combined all the 5 inputs that we have, the multimodal inputs, and replayed back to the experts. So to see this, if this system works better, we wanted to evaluate it, and we interviewed 5 different experts from fields like sculpting, to haircutting, to wildness, to block printing and metal manufacturing. And we had interviewed them with a structured set of questions, where we had what are the training methods that happen in their field, or what are the technologies that they are currently using for teaching their students, and what are the different aspects they face as a challenge in teaching, and also the students in learning. So we also demonstrated our setup to them to show what are the possibilities of the system that we have. And we decided on different tasks that are possible. And we came up with the task not just showing them the correct ways of doing it, but also the incorrect ways of doing it. Because people learn from incorrect ways. And when you know, okay, this is something which you should not be doing, you actually learn it better, is what research says at least. So that we have not just recorded the correct ways or the correct tools to do it, but also incorrect ways and incorrect tools to do it. And then from the interview sessions, we came up with 5 different themes on how to look at these aspects of teaching with the multimodal system. And it's more like a stepwise analysis, where you have not a very big task given to the students at a single time, but then going to multiple steps and looking at individual students' learning capabilities as well. And then the second theme was pedagogical challenges in teaching and learning. How, what are the challenges? How do students trying to bring from the tool to the, imagining the task to bringing it in the interaction, what are the challenges, and how it is challenging for the teaching module when it comes to okay, different student being learning at a different ability level, how challenging it is for the teachers to teach them. And the third theme was how motivational and emotional factors comes into picture in teaching, and what are the technologies, what is the role of technology. Today in the morning, when we were having this panel discussion, we had this question: if XR could be like a complement or a supplement for teaching or learning? So that's one question even we had to the experts, where we were trying to ask them if this technology could be like a complement or more like a replacement for their current teaching methods. So one thing which we observed from all the experts were like it could complement but not replace a human teaching strategies on the learning methods. What even the traditional methods, which has many challenges, definitely technology could be a complement to that, but not a replacement to it. So that, and now we have a plan to use these recordings from the experts and show it to novices and see how novices would learn from these recordings in various conditions, like with haptic feedback, without haptic feedback, and like with imitation, because many people, when I was showing these demos, they were trying to imitate the experts' movements. So like it gives me a good impression that, okay, they are embodied, they are immersively observing things, so they're trying to imitate the movement. So we are trying to see if imitation does that help in a way to learn things. So we are playing these four videos in four different conditions, without haptic feedback and with imitation, without imitation, and try to see if we could help them learn. So we had these visual module, like first person, third person view, like split screen with half and half of both the information. And we have like two speakers playing the interactions and the expert's narration, one on each speaker, left and right. And we had two haptic actuators, vibrotactile actuators. I think Manisha wouldn't agree them to be haptic actuators. They are vibrotactile actuators that play the high frequency signals that we have recorded from the accelerometers while the experts were performing. So we had these information, and we were tracking their eyes, we were tracking their, we had some physiological measurements that we were doing while novices were experiencing these demonstrations. Like we had heart rate variability to see if there is any stress that's been observed. And we had we had a camera recording of them watching. So we were trying to see if they were imitating in the condition they were supposed to imitate, and passively watching them in this condition they were supposed to passively watch. And after they watch the demonstration, they go back to a setup where they perform the task. So whatever they have learned from those 8 minutes to 10-minute videos that we have, they perform a small bit of like 1 minute to 2 minute demonstrations, and we record those demonstrations again from the novices and play them back to the experts, and we ask the experts to evaluate those recordings from the novices. So the experts doesn't know in which condition the novices have experienced these demonstrations, but they would evaluate based on their performance. So we observed that from like the preliminary results that's been happening and the analysis that's happening, we observed that definitely haptic feedback have some influence in teaching them. And having this first person view, we could see from the eye tracking that participants were trying to focus on the first person view when there is an interaction between the tool and the object. And when there is expert trying to narrate more about the gesture, body posture and stuff, the participants were shifting their gaze to the third person view. So that shows like equally important between the two views is something which we observed. And definitely participants preferred to imitate in certain tasks, and it was not observed throughout the task. It's not uniformly like imitation was something which is preferred, because like there was case where we had hair cutting, where the expert had two tools, one comb and the other scissors, where they were interchanging the hands between these two. And having two tools with vibrotactile feedback, switching between these two to imitate, was giving them a challenge of like not exactly understanding what they are trying to do. So they were more preferring to have a passive watching condition in such tasks. But then like for violin and stuff, they were trying to prefer to like imitate the expert's movements, so they know exactly the angle of movement that is being played by the experts and so on. So this is some direction which I want to take it further, is to have something which is more real time, and look at a hospital environment where there is a patient or like a surgery happening, you have an expert doctor performing a task, and then there is a bedside assistant. You could currently imagine the bedside assistant looking at the expert in a third person view, but you don't have the first person view, and you don't know, actually feel what the expert or doctor is feeling. So if you can have something like this system in a real time, where the expert could actually, like the bedside assistant could actually feel what the expert is feeling, and also see what the expert is watching, would give them a better understanding of the task in general and help them learn better, is what my project direction is. And I could see further this taking up to the virtual reality. I think that is one of the questions I had throughout, like whenever I show this demo, like why don't you take this to virtual reality? Why do you just have it on like a 2D screen or something? So yeah, maybe that is some other direction that I would really love to explore. I would have been happier to show some videos of experts doing haircutting, playing violin, but unfortunately, I'm sorry, yeah, it's not able to connect. Yeah, it's still not able to connect, so yeah, but I would be happy to share anything if you are interested, yes. Thank you.
We thank Dr. Ravali Gourishetti for a highly insightful and forward-looking session.